Thank you for choosing Rutland Regional Medical Center for your upcoming medical procedure. In this video, we will demonstrate the typical post-operative course after shoulder replacement here at the hospital. An occupational therapist and a physical therapist will come to your room and evaluate you after your surgery. Your therapist will ask you questions about your pain level, your level of activity, and clarify any help or limitations you may have had before surgery. Pro tip: bring your questions and your educational booklet to your pre-op appointment, and then again on surgery day. Your physical therapist will make sure you're able to navigate your home safely, including stairs, prior to sending you home. Your occupational therapist will help you be as independent as possible with activities of daily living, such as dressing, bathing, and toileting. They will both review your shoulder movement restrictions. These restrictions are vitally important to help you heal completely. You must wear your sling at all times for 6 weeks, except for bathing, dressing, and range of motion exercises. Please practice using your non-operative arm before surgery. Shoulder movement is limited to the range of motion exercises that you will learn later in this video and review at the hospital. You may not lift anything heavier than a standard coffee mug. As a rule of thumb, keep your palm in front of your stomach to help hold your shoulder in a neutral position. Most patients need help with these tasks when they first go home. Please try to find a support person who can work with you on these tasks. It is helpful to have this person with you during your scheduled occupational therapy session in the hospital. Your case manager may assist you with coordination of this appointment. Managing your sling and getting dressed. For the first 6 weeks, you will not be allowed to use your operative shoulder. You will need to wear your sling almost all the time, including when sleeping. The only time you're allowed to take your sling off is during exercises, dressing, and bathing. Tasks that require elbow, wrist, and finger motion only, such as holding a book or typing, are okay as long as you do not use your operative shoulder. Your therapist will work with you on how to manage putting on and taking off your sling. The goal is to keep your shoulder as still as possible during the process. There are many different straps on the sling, each having a specific function. So first we will place the sling on the bed and open up the Velcro straps and move them out of the way so they don't get stuck where they aren't supposed to. Now place the long waist strap across the bed and sit in front of it. The sling should be sitting on your operative side. Using your non-operative arm, carefully place the sling under your operative arm. Lean forward a little bit and gently place your operative arm into the sling. Let your operative arm with the sling relax in place. Using your non-operative arm, reach over and take hold of the strap at the elbow of the sling. Pull it up behind your neck, over your non-operative shoulder, and across your chest and stomach, and secure it to the clip located between your elbow and wrist. Next, using your non-operative arm, pick up the end of the waist strap that is sitting behind you. Pull it around and secure it to the clip on your sling near your wrist. Now, pull the short Velcro strap that you can find near your wrist up and between your thumb and index finger and secure it to the sling on the other side. Finally, pull the short Velcro strap near the bend in your elbow across your forearm and secure it to the other side of the sling. At this point, your arm should be sitting comfortably at a 90-degree angle. You will need to use your non-operative arm or have assistance for most dressing tasks, including taking off and putting on your sling. Please practice completing self-care tasks with your non-operative arm before surgery, as it can be especially awkward when you are having surgery on your non-dominant side. Putting on and removing your shirt. With your sling removed, take your non-operative arm and bunch your shirt up in front of you so that you can slide the sleeve over your operative arm past the elbow. Next, slide your non-operative arm through the other armhole. Now take the hand of your non-operative arm, gather or bunch the rest of the shirt from the neck opening to the bottom while leaning gently forward, and pull the shirt over your head. Use your non-operative arm to pull the shirt further into place. To take the shirt off, first remove your sling. Reach behind your neck with your non-operative arm and slowly pull and gather the shirt up to your neck. Once you have the shirt gathered in your hand, gently pull it up and over your head and slide it carefully off of your operative arm. Range of motion exercises. Range of motion exercises are an important part of your recovery and ability to regain strength and mobility in your shoulder. There are 3 levels of exercises: active motion, active assisted motion, and passive motion. Active motion is when your muscles do all the work of moving your arm with no assistance from a support person or from your non-operative arm. Active assisted motion is when your muscles do some of the work and your support person or non-operative arm does the rest. Passive motion is when you totally relax your muscles and your operative arm is moved completely by your non-operative arm or support person. In all cases, during range of motion exercises, it is important for you to keep your shoulder in a neutral position as demonstrated here. Your occupational therapist will instruct you on how to perform the range of motion exercises at home. Depending on your body type and physical abilities, you may require assistance with your exercises. In this video, we will demonstrate the exercises your surgeon wants you to complete. Following surgery, these should be completed 2 to 3 times a day, 10 repetitions each for 6 weeks. At your follow-up appointment, some weeks later, your surgeon will clear you to begin your physical therapy plan. Shoulder flexion. This exercise requires an active assist from your therapist or support person, or the use of your non-operative arm. Remember, you are not allowed to move your operative shoulder independently for the first 6 weeks. Start with your operative arm relaxed at your side. Raise your operative arm out in front of you. Try not to move your torso to ensure the motion is coming from your shoulder joint. Lift your arm as far as you can without raising it above 90 degrees. Repeat this 10 times. Shoulder abduction. You will need a similar amount of assistance for the shoulder abduction exercise. Start with your operative arm at your side. Raise your operative arm out to the side. Lift your arm up as far as you can without raising it above 90 degrees. Repeat this 10 times. External rotation. External rotation requires passive motion, meaning you are not allowed to use the muscles of your operative shoulder and will need full assistance from a support person or complete help from your non-operative arm. Start with your elbow against your side in a relaxed position with your hands straight out in front of you. Allow your support person or use your non-operative arm to gently push your hand out to the side 15 degrees. Do not go past this even if it does not hurt. Repeat this 10 times. Pendulum exercise. Depending on your balance and mobility after surgery, your therapist may introduce the pendulum exercise. This is performed by allowing your arm to move in a fluid circular motion by using the momentum of your body. Stand and lean forward while using your non-operative arm and a stable surface to assist with maintaining your balance. Using the momentum of your body, allow your arm to move in a fluid circular motion for approximately 15 rotations. Repeat this in the opposite direction. Bicep curls. This exercise requires active motion. You will not need assistance and should only use your operative arm. Allow your arm to hang at your side. Then raise your hands straight up, bending only at the elbow. Repeat this 15 times. During all of this, remember, ice is your friend. After surgery, the use of ice is highly recommended. Ice is used to desensitize the surgical area as well as decrease pain and inflammation. The ice should not be placed directly on the skin. Apply the ice while you are sitting or lying down and keep it in place for 20 minutes each time. Apply ice frequently throughout the day, but especially after physical activity and exercises. Important things to remember. Practice using your non-operative arm before surgery with all of your daily tasks. Wear your sling at all times except for bathing, dressing, and exercises for 6 weeks. Please make sure you have at-home support to physically assist you after your surgery with exercises and your day-to-day activity while you recover. Bring your before and after surgery booklet with you to the hospital. Pro tip: be sure to check on your shoulder and arm position. Always keep it in a neutral position unless you are doing exercises. Finally, it's time to leave the hospital. When you have been cleared to go home, a hospital volunteer will come to your room with a wheelchair to bring you to the hospital exit. This concludes the video on post-operative recovery from shoulder replacement. By doing the exercises recommended before and after your surgery and following your doctor's instructions, you'll be well on your way to recovery. Thank you for choosing Rutland Regional Medical Center for your medical procedure and for taking the time to view this video. All of us wish you a full and successful recovery.